37 would permit physician assistants, registered nurses, nurse practitioners, and student nurses to administer an immunization for an annual seasonal influenza, influenza pandemic episodes, or other diseases that represent a current or potential outbreak as declared by a local, state, or federal public health official. We've agreed to take the committee's amendments. I believe it's removed all of the opposition, and we have a few witnesses here in support.
Thank you. Witnesses in support.
Jennifer Snyder on behalf of MedImmune. They're a biotech company that produces flu mist. They work a lot with different school districts that actually can take advantage of free flu vaccine that they get through their local public health department through the CDC. Many of these school districts have been talking to MedImmune about the fact that they just don't have the personnel available to help with flu vaccine clinics. And the school nurses in particular have had discussions about wanting to include more professionals to help them do that. So we've been working with the Assemblyman to see if we could expand a few of those and make this a little bit more effective and usable for school districts to get the flu vaccine to children who need it.
Thank you. Any other witnesses in support?
Madam Chair and members, Teresa Stark with the California Medical Association. We are pleased to be in support of the bill today. We want to thank the author and the sponsors for working with us to narrow the bill from its introduced version. This is a really important bill, as we saw with the H1N1 pandemic. It's important that we have opportunities to provide access to immunizations in a pandemic situation. This is an important public health bill, and we urge your support today. Thank you.
Thank you.
Madam Chair and members, Linda Ross representing Kaiser Permanente, also here in support.
Good morning. Kristen Hare, California Academy of Family Physicians, also in support.
Thank you.
Madam Chair, member Stephanie Roberson on behalf of the California Nurses Association. Just want to thank the author for working with the nursing community to narrow the bill and bring the legislation back to its current intent. So we removed our opposition and we are now neutral. Thank you.
Thanks.
Thank you very much. Any other witnesses in support? Witnesses in opposition? Mr. Fletcher, we are going to establish a quorum. If you will give us a minute.
Hayashi.
Here.
Emerson. Here. Conway. Ng. Here. Hernandez. Hill. Here. Ma. Here. Nava. Here. Nilo. Ruskin. Smythe. Here. Hernandez.
Which amendments are you referring to? In the
We are taking the amendments that further clarify that the only people this would apply to would be physician assistants, registered nurses, nurse practitioners, and student nurses.
Which are already in the bill.
Which are already in the bill.
Okay, great. Thank you. Thank you for clarifying that. Your bill's been moved, and we have a second by Mr. Smythe. Would you like to close?
Just request an aye vote. I think we've all seen with H1N1, we're concerned about rates of immunization. I think this will better help schools be able to respond and protect kids. Request an aye vote.
Thank you very much.
Motion is due pass. Hayashi.
Aye.
Hayashi, aye. Emerson. Emerson, aye. Conway. Ng. Ng, aye. Hernandez. Hernandez, aye. Hill. Hill, aye. Ma. Ma, aye. Nava. Nilo. Ruskin. Smythe. Smythe, aye.
7-0, your measure's out.
Thank
you.